And then once we come to a conclusion, we do not necessarily leave away the person just saying that they have polycystic ovarian syndrome and start only the tablets necessary for polycystic ovarian syndrome, but also check the person's blood pressure, because these people being overweight are predisposed to higher blood pressure. Also, we also check if the person has any problem conceiving, because some of these individuals do have difficulty becoming pregnant because of polycystic ovarian syndrome. And then coming to the treatment aspect, we try to address each symptom or sign and also the polycystic ovarian syndrome as a whole. Coming to irregular periods, the best treatment for this is weight loss. If these individuals were to lose that excess amount of weight that they do have, then that would facilitate or enable them to have regular periods. So the weight loss of these individuals is going to be central aspect of management of these individuals. So we ask them to do regular exercise, if needed under trainer supervision. We ask them to see a dietitian who can educate them and counsel them about what to eat, what not to eat, when to eat, how to eat, etc., etc. Coming to medications per se, we suggest that they use a combination of hormones, the hormones being cyproterone and ethinyl estradiol combination, which is very popular for this particular disease, and ask them to take it 21 days on and 7 days off and repeat the cycles on and so forth for a certain period of time to regularize the periods. But if they didn't have any period for a while, we suggest them to use progesterone supplements for about 5 days daily once, so that they can shed away that excess layers of endometrium that they have built up because of not having a period. If it is not treated, then that can lead to higher risk of what we call as endometrial hyperplasia, or sometimes even endometrial cancer. So it is important to make sure that these women get regular periods by using medications that I described, apart from also doing regular exercise, diet control and lifestyle changes that would enable them to lose weight. Coming to other problems that these people might suffer, such as your high blood pressure, it is important to tackle it by means of medications if required. Of course, cutting down salt in the diet also helps. Losing weight in itself also helps excess blood pressure. Coming to excess lipids, if the lipids are very bad, that means if the bad cholesterol is very high, we may have to start these individuals on cholesterol lowering medications if they're not planning children immediately, because some of these medications may be contraindicated in people if they're pregnant. Coming to other aspects of PCOS, it is pertinent to state that these people do have higher rates of depression and low mood compared to individuals who don't have polycystic ovarian syndrome, whether it is due to just being overweight or because of other issues such as excess hair on the face, lower self-esteem, we really don't know. But on the whole, these individuals do have higher rates of depression and low mood. So it is important to tackle that aspect as well with some empathy whenever these women come to our clinics. Then coming to one important aspect which is usually ignored, some of these individuals do suffer from a condition called sleep apnea, which is a condition wherein people have lower oxygenation of their blood because of blockage of their airways because of being overweight during night times. So it is important to advise these individuals to lose weight and also seek appropriate attention of the sleep specialist if they were to suffer from this condition called sleep apnea. Coming to blood sugar, it is important to again reiterate in this context that these individuals are predisposed to developing type 2 diabetes because of their obesity. And I want to clarify one thing here. Many people think that they became obese because of PCOS. It's not true. It's the other way around. It is because of their obesity that they developed polycystic ovarian syndrome, along with the genetics that are not quite good in these individuals, or the genes that predispose them to polycystic ovarian syndrome. So please do remember, PCOS does not necessarily make a person obese. It's the other way around, which means if a person is overweight, then they develop polycystic ovarian syndrome. And coming to excess hair on the face, there are various means by which this can be tackled. There are creams such as eflornithine, which is a topical cream that is applied twice a day. Also, there are other methods such as using some tablets like spironolactone under appropriate vigilance, which can decrease the facial hair. Of course, there is always laser treatment and other cosmetic measures using which excess hair on the face and on the bodily parts can be curtailed. Coming to acne, the standard acne treatments do work. Sometimes we do take the help of a dermatologist in this regard. And last but not the least, we need to remember that conceiving and miscarriage during pregnancy might be an issue in some of these individuals, and we ask them to make sure that their blood sugar levels are well controlled before they plan their pregnancy. We use metformin in people who may benefit in such a scenario. Metformin can help lower the blood glucose levels. It helps the individual possibly to become pregnant as well if they are having difficulty conceiving. Not to forget, if these individuals really have significant difficulty, clomiphene citrate is one medication that can be tried, and not to forget the help of fertility specialists as well if at all they are really struggling, in which case in vitro fertilization, i.e. IVF, can be used if required. So ladies and gentlemen, so far you have heard about polycystic ovarian syndrome, which is not an uncommon condition, which is found in quite a few women, especially if they are overweight. And I think I tried to discuss with you about the causes, the signs and symptoms, the tests that we do, the treatments that are available, and the importance of weight loss and lifestyle changes in these individuals. So please do pass the message if you, your friends, your relatives, or anyone that you know of might be suffering from this for their education purpose. Thank you.